Hi, everybody. My name is Erin, and in this channel, I'm going to be talking about how I'm solving my UARS, or I guess I say it in my head, UARS, and sleep apnea. Um, and so, if you want to skip my explanation of why I'm doing this, then you can skip ahead like maybe 2 or 3 minutes, and then I'll get into what this particular video is about, which is my interview with Cantarella in Treviso, Italy. Probably saying his name wrong, but that is what it is. So the reason I'm doing this is because I discovered that I had sleep apnea in 2022, made a lot of sense, figured out, I was really tired all the time, and now I had an explanation for why. And it was a struggle to get diagnosed. It took like a year. And I had to do multiple sleep tests to get diagnosed. All the while, I felt like my brain was like melting and leaking out of my face. It was horrible. If you're watching this video, you probably understand, the depth of that tiredness. So I'll talk more about that, I guess, at some other point. But eventually, I got a CPAP. I got diagnosed, and it was a low AHI of 7 and a high RDI of 22. But yeah, and so I was like so elated to get the CPAP. I thought it was going to be like my ticket to feeling better finally. I was so excited. And then I had an opportunity. I left my brick and mortar job and I got an online job, and it was just great. And I decided to take this opportunity to travel the world. I quit my US health insurance. I was really pumped. I felt very grateful. So, I thought I'd just be using the CPAP and then I'd be all set after that, and thought I was good. But then I couldn't get used to the CPAP. I was like going to these different places around Europe and working, and everything was great, except for that I still felt like I was dying. And at first, one of the problems was like air would rush out of my mouth and wake me up. So I tried mouth tape. That didn't work because even like the air coming, like, I guess it comes this way, coming up from my throat into my mouth and like separating my tongue from the top of my mouth, it would wake me up. Or my like cheeks puffing up, that would wake me up. So it just wasn't working. Um, and then I started to like wrap a bandage, like one of those that's like reusable for like your ankle or your knee or whatever, around my whole face to keep all this like towards my teeth like it's supposed to be, and not wake me up. And that kind of helped that problem. But then the higher up I turned the CPAP, I still couldn't really treat my issue. I was like looking at my data on Oscar, and I wasn't fully treating the problem. So I would turn it up like zero point 0.2 liters, uh, and try to treat it. But if I tried to go over like 9.2 for inhale and 8.0 for exhale, then I was getting horrible aerophagia. And it made sense because I have a congenital weak lower esophageal sphincter. So like the sphincter in between your throat and your stomach, it's just weak for me. So mandibular advancement device didn't work because I'm class 3. It hurt. So I finally splurged for a BiPAP, and it was still happening, all these problems. Even though I read that it was better for aerophagia. So, I'm only partially treating the sleep apnea now. I do the head wrapping. I'm doing like myofunctional exercises and posture exercises. I wear a cervical collar. I use a tongue retainer to keep my tongue, which is apparently kind of a large tongue, out of my throat. And then I do an eye mask, earplugs, and then this is kind of a side, but I realized that it was getting really bad before my monthly cycle, and it's something to do with your hormones for like whenever your uterus, or if you're a woman, if you have one, it prepares to shed its lining, and then it relaxes all the muscles in your body. So my sleep apnea was way worse before that. So I've started birth control. I'm trying everything. Anyway, so in Bosnia, I started having some chest pain, so I went to a doctor. They did a bunch of tests, diagnosed me with left ventricular relaxation disorder and asymmetric septal hypertrophy, which is kind of like a big deal, of my heart, 2 heart diseases. I had some head pressure and some dizziness, some weird vision changes, heard like whooshing in my ear. And I was in Italy at that point, and I was diagnosed with intracranial hypertension by a neurosurgeon. And then, all these diseases are directly related to untreated sleep apnea. And, I've lost weight. I'm still losing weight. It's just not helping. And it's not helping the diseases either. They just keep progressing because I can't fully treat the sleep apnea. So, I made the decision that I really have to do something about this. Because it's killing me slowly. I'm only 35. I shouldn't be having this many problems. So I started really hardcore research, and I'm trying to really figure this out. I've read a billion journals. I've watched a million YouTube videos, like I'm sure all of you have done. And I joined the jaw surgery subreddit, which if you haven't, you totally should, in the UARS subreddit. Pretty good parts of information, hours and hours and weeks on end of research for this, trying to figure out what the different procedures are, what's recommended, what's not, and why. It's just crazy. And then it would take as much money as it will to have the surgery in Europe, to go back to the US, restart my life there, get a car, get health insurance, get car insurance, get a different job, on and on. So I'm just going to do it, pay out of pocket in Europe and keep doing what I'm doing. But that's what this is all about. Figuring out the steps that I was taking and have been taking and will continue to take, that's going to help me solve this issue once and for all, so I can stop slowly dying. And hopefully this can help at least one other person, because I know a lot of people out there are looking for this kind of information, and sometimes you really can't find it. So let's see. Yeah, so I can't afford the FME or E's with Casey Lee, so I needed to find another option. So I just did a lot of research, and I found Cantarella in Italy, in Treviso, Italy. There's a few different doctors that do what I'm talking about, which is part of the whole thing. So if you have UARS, you might need some sort of maxillary expansion. And I wanted to rule that out before I went ahead and tried to get MMA surgery or something like that. So yeah, I didn't go with the other doctors in Spain or Germany or whatever, because I've read patient complaints about them and people that have lingering pain, or they're using techniques that don't really, they're not really recommended anymore. So, and Cantarella seemed like he's pretty good, so I went with him. Plus, he was also mentioned by Casey Lee in an online YouTube presentation that I watched. So I was like, hey, sounds like a plan. I went to Treviso, Italy. I just had the appointment a couple weeks ago, and it was easy to schedule. Everybody there is really nice. I'm pretty sure that the consultation fee was $250. It's a little pricey, but he spent an hour at least with me, or maybe more. He gave me his full attention. He explained every question that I had. He did x-rays, a 3D scan of my bite and everything. He told me everything about the expansion and how it might help me in my nasal breathing, which also sucks, and I might need to do something about that separately, or I don't know. We'll have to figure that out. But basically, he explained that they do custom MSE there, in that it would give me parallel expansion, and that since I'm 35, that he wouldn't do, or I don't know if they ever do, but he wasn't going to do an assisted split. So Casey Lee and other people like that will go in and split open the mid palate suture up there. But he doesn't do that, and that sounds a little painful for me. I'd rather not just have it split by force. It seems kind of intense. I kind of wonder why more people don't adopt that, the new method of doing things. But in any case, he said it would take a year. And then I also read that a lot of people that are trying to get expansion for resolving sleep apnea and breathing issues, it's it makes it even worse to have a custom or any kind of expansion thing in your mouth. And I don't know if I would survive this getting worse. You know what I'm saying? I feel like I might die. So not to be dramatic, but it's just hard to imagine dealing with an even more severe issue than I already have. He was a little dismissive of my AHI and RDI, but he went along with that I needed treatment anyway. But yeah, it's a little disheartening, because it's very obviously very negative for your health, even if it's not a high AHI number. Plus, when I look at my Oscar data, and this may be the same for you too, there's plenty of times where it doesn't record as a complete obstructive apnea, because there's tiny little flutters where the air goes in a little bit, barely any. And so it's like, that's not 10 uninterrupted seconds of breathing, because it's like, but it's barely, it's, I don't know. It just doesn't seem to be correctly like measuring all of that. Or maybe like the parameters are too small. Anyway, so he said that I only need like a 4 millimeter expansion, which isn't really too bad, but he said that it was worth to do anyway because it would help me like set me up for a really successful like double jaw surgery and stuff. And so I asked him, what do you think that the movements would be for a double jaw surgery? And he talked about the surgeon there at Treviso Hospital, the jaw surgeon, who I looked up. I forget their name, but they don't have great reviews. So, this is like the most major decision I'm ever going to make, maybe. And I'm not going to trust somebody that doesn't have like super great reviews. There's even just like a few bad ones, like straight up bad ones. But anyway, he said that there would be like a counterclockwise rotation and then also like a this way rotation to fix some asymmetry, and then moving the lower jaw forward a little bit. And then he said something about like compensating and shaving off part of my chin, which is fine with me. And then he said that the upper jaw would only come forward maybe like 5 millimeters to fix everything. And from what I've read, not that I'm like a doctor or anything, but that is not enough to cure sleep apnea. Apparently, sleep apnea is suggested for at least 10 millimeters. And then the guy that figured out that that UARS is a thing suggests at least 14 to 15 millimeters. I forget his name, but I'll put it in the description so you can like look him up and if you care. So all these experts are suggesting way more advancement. So yeah, I'm not interested in doing something that's not going to completely cure me. So I thought, I'm probably not going to go this route, but it was nice to have that as a consultation. If you're interested in an MSE, it might be a good option. In Treviso, Italy, it's an interesting place, and Venice is really close by. If you're into that, I visited Venice for a day, and that was really cool. Let's see, but yeah, so I guess that's it for the review of him, and then next week I'll talk about my sorry, I'm like really tired, and I'm trying to power through this, but my consultation with Dr. Milesi in Vienna, Austria. And her name gets thrown around a lot when people are talking about surgeons in Europe, so you might be interested in that. So stay tuned and make sure you like and subscribe. And we can go on this fixing our sleep apnea journey together. Thank you for watching.